Thank you for joining me today to learn about eye movement desensitization and reprocessing therapy, commonly known as EMDR. For those of you who are unfamiliar, EMDR is a behavior-oriented psychotherapy treatment. EMDR utilizes 8 phases of treatment, along with rapid rhythmic eye movement or bilateral stimulation to access and process unprocessed traumatic memories stored in the brain that cause distress or negative symptoms. Dr. Francine Shapiro developed EMDR therapy in 1987. While walking one spring afternoon in California, Dr. Shapiro had been thinking of something disturbing, a nagging negative thought, when she suddenly realized that the negative thought had disappeared on its own. As she walked, she noticed that when a negative thought came to mind, her eyes moved diagonally, very quickly, and upon returning to the thought, it had lost its emotional charge. She concluded that eye movements seemed to have a desensitizing effect that decreased the negative feelings associated with her own troublesome memories. She began testing her observations and added other elements, including the 8 phases of treatment, to fully develop the therapy. In 1988, Dr. Shapiro began introducing EMDR to professional organizations throughout the United States. And just 2 years later, in 1990, she began training other mental health professionals in the therapy and created the EMDR Institute. Development, testing, endorsement, and growth of EMDR have only increased since then, with over 100,000 clinicians worldwide using this therapy. So how does EMDR work? The cause of symptoms is unprocessed negative or traumatic memories stored in networks that govern our unconscious and conscious. The adaptive information processing system in our brain processes our experiences and stored memories in a usable form. However, when a negative or traumatic event occurs, the information processing may be incomplete due to negative feelings or disassociation. This memory is then dysfunctionally stored with many elements left unprocessed. Basically, there's a block. When similar situations trigger this memory, the person may feel like they are reliving it and experience symptoms such as chronic disturbing emotions, lack of safety or control, chronic distressing physical sensations, uncontrolled behaviors, or anxiety or depression. EMDR treatment works by accessing and processing the distressing memories, current triggers, and future templates. Information processing is thought to occur when the targeted distressing memory is linked with more adaptive information. Learning then takes place, and the memory is stored with more appropriate emotions that can guide the person in the future. Essentially, the block is removed, allowing healing to occur. So the role of eye movements. EMDR is unique in that it involves rapid rhythmic eye movements or other bilateral stimulation that simultaneously engages both sides of the body. While eye movements are the most common, bilateral stimulation may be visual with eye movements or following a light, tactile with tapping, or audio with alternating tones. These bilateral stimuli engage attention to an external stimulus while simultaneously focusing on internal distressing memories. Well-case and control studies support the hypothesis that bilateral stimulation can aid in desensitizing traumatic memories and accompanying emotional distress. It is broadly not understood how or why. Some researchers believe that the eye movements mimic what happens during REM sleep when the brain processes memories. Others point to various cognitive phenomena that cause the brain to file away traumatic memories in a healthier way. Dr. Shapiro herself believed that the bilateral stimulation changes neural pathways in the brain. How and why it works ultimately, however, is still being studied. So who can benefit from EMDR therapy? EMDR was first introduced and is most commonly used as a treatment for PTSD, but is meant to be compatible with all major psychotherapy orientations. EMDR does not have application, however, to every clinical disorder, including physiologically based disorders such as schizophrenia or bipolar disorder. Because EMDR is a treatment for distressing memories and related pathologies, it may be most effective in treating disorders that follow a traumatic or distressing experience. This may include significant trauma events, but it could also include adverse, distressing life experiences such as marriage conflict or harsh parenting, anger, peer or social humiliations, or life failures. Studies show EMDR to be effective in treating several disorders, including trauma, acute stress disorder, anxiety disorders, depression, attachment disorder, and even social phobias. Empirical evidence. EMDR has been tested in more than 30 controlled outcome studies, resulting in more research than any other trauma treatment method. These controlled studies show that EMDR achieves similar or superior results to other trauma treatments. EMDR has been endorsed by and accepted as the treatment of choice for PTSD and stress disorders by many professional mental health organizations, including the American Psychiatric Association and the World Health Organization. EMDR has a broad base of published case reports and controlled research, including more than 20 randomized studies that support it as an empirically validated treatment of trauma and other adverse life experiences. The counseling relationship in EMDR is also very important. The nature of the counseling relationship is that of a working alliance. It is distinct from other psychotherapeutic approaches in that the EMDR therapist is considered the expert in the structure, but not the content of the therapy. The therapist is responsible for activating the process by asking open-ended questions and adding the bilateral stimulation, but relies on the client's own information processing system to process the information and memories. During the early and later phases of the treatment, the relationship is more developed and active, with attunement, empathy, and prompt reactions in a safe, sensitive environment being key to developing a secure and successful therapeutic relationship. The goals of EMDR therapy are reasonably straightforward and include the elimination of symptoms and suffering from those struggling with PTSD, trauma, anxiety, and several other disorders. Specific goals include the healthy ability to self-soothe, the ability to feel a full range of emotions, maintain self-awareness, and be a healthy contributing member of society, which includes the ability to interact and bond with others, cope with struggles, maintain a positive outlook, establish boundaries, and empathize with others. Now, moving on to the therapeutic process, there are 8 phases of this process in EMDR treatment. The first is client history, which is identifying the target memories for processing, including past events, present triggers, and future needed behaviors. The second phase is preparation, and this involves teaching techniques for affect control and processing, including self-control techniques and stress reduction techniques, so that the client knows that they can handle any disturbances that come up in the session and in between sessions. The third phase is assessment, where the client identifies components of the targeted memory, including visual images related to the memory, related negative self-beliefs, and emotions and body sensations. In addition, the client identifies a positive belief. Therapist helps the client rate both the negative and the positive belief as well. The fourth is desensitization. In this phase, the client is instructed to focus on the image, negative thought, and body sensations, while simultaneously engaging in the EMDR processing using sets of bilateral stimulation. These sets may include eye movements, taps, or tones, and the type and length of these sets are different for each client. At this point, the client is instructed just to notice whatever happens spontaneously. After each set of stimulation, the clinician instructs the client to let his or her mind go blank and to notice whatever thought, feeling, image, memory, or sensation comes to mind. These repeated sets with directed focus attention may occur numerous times in a loop throughout the session until they're ready to move on to the 5th phase, which is installation. This is when the client reports no distress related to the targeted memory. They are then asked to think of the preferred positive belief that was identified at the beginning of the session. This promotes the linkage of the distressing memory with new connections and strengthens positive beliefs. The 6th stage is body scan. When the client thinks of the distressing memory again, they note how they feel physically, with the goal being to eliminate negative residual physical sensations. The 7th stage is closure. The client here is asked to keep a log between sessions of any material or anything that comes up. This helps to establish equilibrium and stability between sessions. And the 8th and final stage is reevaluation, where the client and therapist are examining progress to ensure that all aspects of the memory network have been processed. EMDR and neuroscience. Studies have found that PTSD symptoms are reflected in actual changes in brain activity. At the same time, case study research has provided some evidence that shows brain activation patterns, including increased frontal lobe functioning, may follow effective EMDR treatment. In addition, neurobiological studies have shown significant effects, including changes in cortical and limbic activation patterns and increased hippocampal volume. At the same time, any hypotheses concerning EMDR therapy's neurobiological mechanism are speculative at this time, but the studies and the research in this area linking the two seem to be really promising. EMDR therapy shows promising, if not hard to believe, results at times. So take, for example, a 2006 study where EMDR therapy was used in the treatment of sexual predators who were themselves victims of molestation as children. With EMDR, these individuals accessed and processed the memories of their own trauma, resulting in their getting in touch with the pain and feelings they experienced at the time they were abused, and allowed them to put the blame where it belonged, on their abuser. Only then were they able to take responsibility for what they had done to their own victims. 1 year later, after therapy, 9 out of 10 participants no longer experienced feelings or physiological responses related to deviant behavior, and in fact, were working with the police to help other survivors of abuse. Results like this can seem incredible. At the same time, the reason I chose to study this therapy is because, as far out as it can seem at times, I have multiple close friends who have experienced incredible healing through EMDR therapy. As one EMDR trainer said, "We've got all these theories about why it works, but until you've experienced it or seen it happen with somebody else, it doesn't even seem realistic." I hope that this has given you a brief but good introduction into the therapy of EMDR, and that it is something that you'll be able to look into and consider in the future. Thank you so much.